Hello everyone, today I would like to talk about mental illness and this video for my midterm test. So let's get started. My lecture has a case about mental illness, but before we read the case, I would like to tell you about what is the exactly mental illness or mental disorder. So just listen to me. What is mental illness? Mental illness is a mental, behavioral, and emotional disorder which makes it difficult for people to work, socialize, and do other activities. There are various kinds of mental illness symptoms based on type of mental disorder. Symptoms that occur can affect physical and physiological condition, as well as affect emotion when talk. Examples include confusion when thinking and decreased ability to concentrate, feeling sadness and difficulty feeling happy, excessive anxiety, often feel afraid, continuous feeling of guilt, and mood that change frequently. That's symptoms from mental illness, and there are several methods to help people with mental health problems, including through psychotherapy and treatment medication by antipsychotic. Psychotherapy. First, this is therapy used an interactive method with a psychological approach, also known as speech therapy. Psychotherapy is done through phone between the patient and therapist. The second is treatment medication by antipsychotic. Medication can be given by a psychiatrist to relieve the symptoms. Different types of mental illness then different handling. The type of psychotic disorder that attack the mind can usually be treated medically. So, meanwhile, personality disorder are better treated with psychotherapy. However, the result will also vary for each individual. That's about mental illness and mental disorder. We can see the case before I answer a question. So let's see the case.
Forced treatment of the mentally ill. Ms. FZ and Ms. FG had been involuntarily committed to a psychiatric center. Each was being retained pursuant to orders of the local county court, which had found them to be persons in need of involuntary care and treatment, in that they have a mental illness for which care and treatment as a patient in a hospital is essential to their welfare, and their judgment is so impaired that they are unable to understand the need for such care and treatment. These patients refused to be medicated with antipsychotic drugs. Their objections were overruled, and they were subsequently medicated with various antipsychotic drugs. Mr. and Ms. FZ thereafter commenced a declaratory judgment action against the commissioner and officials of the psychiatric center. They sought to obtain an injunction against the non-consensual administration of antipsychotic drugs and a declaration of their common law and constitutional right to refuse medication. Ms. FG refused treatment with antipsychotic drugs but was thereafter forcibly medicated. She alleged that the forcible use of antipsychotic medication violated her common law and constitutional right to determine her own course of treatment.
that case you write. So my lecture question is, should the hospital allow mental ill patients to determine their own course of treatment? So my answer is no. The right to decide what treatment to choose is the right of a sane patient, because a sane patient can determine what is good for their own body, while people with mental illness tend to have unstable feelings. As I mentioned you earlier before, their symptoms of mental illness is confusion with their own feelings. Therefore, mental illness patients have a tendency to be confused in choosing and actually cannot even choose what is good for themselves. Besides confusion, mental illness patients usually have excessive fear that even they can hurt themselves and people around them. Therefore, for their own safety, it is appropriate for the doctor to determine what treatment will be performed on mental illness patient, because doctors understand the patient condition better than patients themselves. In addition, the hospital also has operational standard that will guarantee patient safety. The doctor's decision must also consider all things well, so that the recovery of the patient guaranteed. Mental illness patients can be endanger those around them because of sweet unstable feelings, and therefore mental illness patients should be treated by the right hand, and that is doctor and medical personnel, regardless of the right of patient who is free make decision. Doctor and medical personnel know and understand more about what is the best to do so patients are safe. That's my answer and my consideration about this case, about this demo for my midterm test. Thank you for watching and stay safe for this COVID-19. Thanks to watch me, thanks to understand, and thanks to